Hi, I'm Mihaela Telecan and you're watching Healing with Foods TV, your source of nutrition and wellness information, helping you take charge of your health and happiness using real whole foods as medicine and much more. I have a question for you today. Do you know the numbers that can predict your premature aging? I'm talking not bank account, I'm talking numbers in your blood values. Well, I have with me today Dr. Jennifer Cronin. She's a functional medicine doctor located here in Jacksonville, Florida.
Dr. Jen Cronin is a general practitioner specialized in anti-aging medicine and preventive proactive health care. Dr. Jen graduated from the George Washington University School of Medicine and moved to Jacksonville to do her radiology residency. After the opportunity to stay at home with her two young daughters, she has followed her passion, both personally and professionally, to live her best life and help her patients achieve the same thing. She continues advanced training with the Institute of Functional Medicine and the American Academy of Anti-Aging Medicine. She has an anti-aging medical practice in Jacksonville Beach, Florida, where she provides patients with scientific evidence-based treatments that promote optimal health and prevent chronic diseases from the inside out. She develops partnerships with her patients and gives them the tools to make lifestyle adjustments, balance hormone, maximize nutrition status, and prevent chronic diseases of aging. Including in her anti-aging philosophy, Dr. Jen uses the latest skin rejuvenation procedures, including laser and a non-surgical ultrasound facelift device to enhance inner beauty.
Hi, Dr. Cronin. Thank you so much for being with me today and with my listeners. And I'm super excited about our topic today.
Thank you, Mihaela. I appreciate you having me here today.
My pleasure. So I already kind of throw out that question there. Numbers that predict your premature aging. Before we get into that, however, I would like you to tell us a little bit about yourself. How did you get into functional medicine and anti-aging medicine?
Well, I moved to Jacksonville about 10 years ago to do my radiology residency after graduating from medical school. And so I ended up taking off a couple of years to raise my daughters. And then when I wanted to get back into medicine, I was like, really, what's my personal philosophy and how do I live my life? And I really wanted to focus on preventive medicine and looking at the body as a whole and really doing the things from a lifestyle perspective and nutrition perspective that we can do to prevent chronic disease and stay healthy, instead of waiting until disease happens and handing out a pill for everything.
Prevention is the key, and if we can use lifestyle changes, it's the way to go. So let's dive into our topic of discussion today. You told me that there are numbers in our lab tests that can predict how quickly or premature we are aging. What would those be?
Well, there are many tests that I feel like I do that are a little bit different than most standard, physician laboratory tests that are offered today. And so I feel like they give you a lot more information. And so I just chose 3 today to talk about. And so I wanted to start, the first one is a fasting insulin level. And so typically, most doctors will just order the blood sugar, blood glucose levels in the blood and look at that in determination of whether or not you have diabetes or have an elevated blood glucose level. So insulin is a hormone that is produced in the pancreas in response to the glucose that we take in through our foods. And so insulin actually helps with the uptake of glucose into the cells and for energy and for fat storage. So what happens is that if, over time we are putting in large amounts of glucose, from our foods and sugary beverages and carbohydrates like breads and pastas, the insulin level has to increase to match the amount of blood glucose that's in, in the bloodstream. And so the pancreas after a while just cannot keep up. And so the insulin just isn't effective at all at taking the glucose into the cells, even though there's a lot of it in the bloodstream. And so you will develop insulin resistance.
In other words, the insulin is there, but cannot do its job.
Exactly.
It's just ineffective. It's like a tired worker.
Exactly. It's, been overloaded and just cannot respond in the same way. And so,
So what's the result?
And so the result is diabetes, so what's interesting is that insulin levels, and this is why I test for that, have been shown to rise even decades before you even might see an increase in the blood glucose levels. And so that's why it's so important to detect it early on, so that you really can have interventions earlier than waiting for the development of diabetes.
So in other words, if you test my insulin level and the number is high, and we're going to get into numbers in a second, and my fasting blood sugar is still normal, that already tells you that there is a problem in the way my body metabolizes sugar. So if I take action now, I can prevent the diabetes that will onset maybe 5 years from now. Is that correct?
Exactly. And, it's amazing how many people really, you don't, even if you have like blood glucose levels that are high, you don't really get a pre-diabetic, diagnosis, or, you kind of wait until you have, full-blown diabetes. And so this is a great way to, give patients the tools and lifestyle modifications and nutritional planning and the right tools to, prevent the chronic diseases that can happen and with diabetes.
Total agreement with you in here. Now tell us, how is this test done? Is it easy to prescribe this test, and what the numbers we look for?
It's very easy. Fasting insulin, you just have to have your doctor order it in addition to the regular, they will test your blood glucose on a normal basis. And so it's a blood test as well. It's fasting, so you go first thing in the morning after not having eaten for at least 8 hours, and they'll draw your blood. And so the numbers that I look for is a fasting insulin level greater than 5 milligrams per deciliter. So anything above a 5, I take as an elevated level and start intervening at that point. And so a doctor can also order a 2-hour glucose tolerance test, which looks at both glucose and insulin levels, as kind of a follow-up on that as well. But just looking at a simple blood test can give you a lot of information. You just have to know to order it.
And you can already intervene, take action. So your first number that predicts your premature aging is insulin fasting greater than 5. Great. So now we can move on to the next one.
So the next one is vitamin D.
Okay.
And it has so many different functions in our body. Vitamin D is actually a hormone and not really a vitamin. And we know this because almost every cell and tissue in the body has vitamin D receptors on it. And so vitamin D, we know is important for bone health. But now, we know that vitamin D is responsible for a lot of our immune function, our metabolism, has a lot to do with our mood, memory, cognition, and even could lead to depression and weight gain, and even is important in preventing some cancers.
So vitamin D is another number that you want to know, and we'll get into the numbers in 1 second. Your best source of vitamin D is your skin under the sun. Your body produces vitamin D using cholesterol in the skin when it's exposed to sun. So tell us, how do we test for vitamin D and what do we look for?
Well, vitamin D, again, is just a simple blood test that you can order. And so you want to look at 25 hydroxy vitamin D levels in the blood. And so, their laboratories are all a little bit different on their normal range. And so this normal range really just indicates whether or not, we look at rickets disease as, what vitamin D levels were kind of based on, if you have a deficiency or not. I don't feel like these numbers are adequate as far as the optimal goal range for my patients. And so, anything below a 30 nanograms per milliliter is considered a deficiency. But for me and my patients, what I shoot for the goal is 50 to 80 nanograms per milliliter. And so, if anybody is below 50, I definitely will supplement that patient. And so depending on, their level of deficiency, I'll supplement anywhere from 5 to 10,000 IUs daily. And then I'll recheck at about a 3-month period, especially, if I'm supplementing a significant amount of vitamin D, I want to see where they are. But a lot of times it can take 6 months, 10 months, a year to replenish the vitamin D stores. And then once I get them to an optimal level, usually a maintenance dose is about 1 to 2,000 IUs daily. And I use supplements because we really are not getting enough from our diet.
Diet is not a good source of vitamin D. Vitamin D, the best source really in terms of food is fermented cod liver oil. However, even that may not be enough to bring you to optimal levels, because the way the fermented cod liver oil comes from nature, it comes with vitamin A also, and K, and it has all the fat soluble vitamins, but the vitamin A levels are quite high. So for you to reach optimal level by using fermented cod liver oil, you will go into toxicity from vitamin A. So that's why the best way to supplement is the vitamin D3, like Dr. Cronin was saying, and that goes according to your numbers. So it's not whatever you think, 2,000, 5,000. You have to go, it's a certain scale, at least that's what I use, that according to the blood level, we know exactly how many units we supplement, and it gets retested.
So that's why, it's super important to know exactly what that number is, so that you know how much supplementation to take. And, you want a really good quality source, and you want an active vitamin D3 supplement. And you had mentioned about the sun as well, and it is by far the best natural source of vitamin D for our bodies. And but it's, over 60% of Americans really have vitamin D deficiencies. And even, we live here in Florida, and we think that, we get enough sun exposure year round, but we don't.
For many reasons.
Right. One of the biggest reasons is, we're trying to prevent skin cancers by using our sunscreen and sunblock. And so this really decreases the production of vitamin D by up to 97%.
And most of us spend most of our day indoors.
Exactly.
So it's not like we spend every day at least 20 minutes under the sun without sunscreen. So that's why the best is to know your numbers. Anywhere between 50 and 80 is considered optimal levels, and even to keep them there, if you're not in the sun on a regular basis without sunscreen, your best option is to add a small amount according to your number of vitamin D3 supplement. Wonderful. So we made light into 2 numbers, the fasting insulin and the vitamin D. What's the number 3?
So number 3 today is actually another hormone that I feel like is very important, and it's called cortisol. So cortisol is a hormone produced in the adrenal glands. They're little glands that sit on top of the kidneys, and cortisol's released in response to a stress response in the body. So we all can think of stressors today in our work and our families and our cell phones and computers and all of that, but it also can be an infection that's occurring in the body. And it's a normal response for our body, and in the acute or the short-term phase, it actually can help our bodies And so we think about, being chased back in the caveman era, by the dinosaur. So, we really need to get away fast. So our body compensates by releasing this cortisol, which increases our blood pressure, our heart rate. It releases blood sugar into our stream so that we can have enough energy to run away. It takes calcium out of our bones to give to our muscles so that they can contract and work harder. And so, the problem occurs when you have elevated cortisol levels for a long period of time. And so that's, the situation today many times is that we live at an elevated cortisol state. And so once, you have this elevated cortisol for so long, it leads to weight gain and fatigue, difficulty losing weight, depression, memory problems, insulin resistance, sleep deprivation, insomnia, things like that. And so it's really important to know what your cortisol number is. And so a lot of times what can happen too is that, if we have a really high cortisol level through our body, it can lead to disease processes, but then our adrenal glands will give up, much like the pancreas and the insulin, and say, I just can't keep up with the demand here anymore. And so then it will lead to adrenal fatigue or adrenal exhaustion, and so that your body just can't mount a response anymore. And so that also causes a lot of problems.
Sounds like cortisol is another super important one if you want to live long, healthy, functional years. So how do we test for cortisol and what do we look for?
The cortisol, actually I do a little bit differently. It's not a blood test. I like to either collect it using a 4-point saliva collection that the patient does at home in a kit, or a 24-hour urine collection. And the reason that I do that is because cortisol is produced in the body on a circadian rhythm, or based on our sleep-wake cycles. And so I want to look at the overall 24-hour trend of the cortisol. Typically our cortisol levels are at their peak in the morning, like 6 to 8 a.m. in the morning anyway, and then they'll come down over the day, and our lowest is about midnight. And so, I want to see what the trend is throughout the day, but especially with people with elevated cortisol levels, I will usually see, a peak higher than the normal peak in the morning.
And stays up at night too, when it's supposed to go down?
Exactly. And so, you will see basically an elevated cortisol, and it can be throughout the day, and according to, the natural curve. And so, and then if people have reached adrenal exhaustion, their cortisol levels are just going to be a flat line throughout the day. And so I have so many patients who are like, I'm exhausted, I can't drag myself out of bed, and so they're reaching for caffeine all day long, or sugary sweets and for a pick-me-up, and they're like, I can't lose weight and I can't sleep. And so it's just really an important number to look at, and so that you can intervene.
So what would you do? What's in terms of at least lifestyle modification?
Well, and that's where I always start. Is the number one place. Really, looking at your lifestyle and figuring out what we can do to reverse the trend. And so it's where are your stressors coming from, and addressing those. Really having a good sleep hygiene and regimen is really super important to reset your adrenal glands and lower your cortisol levels. Taking out foods, dairy, gluten, but also alcohol, caffeine, sugars that are contributing to that. And then supplementation wise, I will use certain things. Vitamin B6 is very important, all your B vitamins. Also adaptogenic herbs, such as rhodiola, ashwagandha, to just name a couple of them. But I will use an adrenal support complex. Usually adaptogens kind of regulate your body balance and homeostasis with your cortisol response. And so then I also use a hormone called DHEA, which works in conjunction on an inverse relationship with cortisol, so it's an important number to know as well. And other supplements, vitamin D, super important too. So
all ties in together. It's not one organ that's more important than the other.
no, it's a complex orchestra of
Yes.
of
Each
reactions
one plays
going
its
on.
own
So
role.
right.
And when you work with all of them, that's why it's a holistic approach. That's when you get the most out of it.
Exactly. So, you have to have everything in balance.
Yes. Wow, excellent. This was wonderful. So let's recap number 3. Number 3 was cortisol. We didn't go over numbers because it's not necessarily specific numbers. It's a curve we look at over the 24-hour cycle. And based on your curve in rapport to a standard curve, a specialist such as Dr. Cronin would know what recommendations, personalized recommendations to give you, starting with lifestyle changes. So thank you so much. I really, really loved our discussion today, and I hope you are doing that too. Insulin, vitamin D, and cortisol, 3 numbers that predict your premature aging. And now it's your turn. Dr. Cronin and I would love, love, love to see your comments right below this video. And let us know what numbers you've tested and you worked on, and the improvements you've seen. Now, before we say goodbye, I want Dr. Cronin to tell us where you, my audience, can find you.
I see patients for basically an anti-aging evaluation or a nutritional and metabolic evaluation and workup. And so you can call my office and schedule an appointment. 904-400-0283. Or you can look me up on my website for additional information. And I'm at www.welldefinedantiaging.com. You can follow me on Facebook. I always have a lot of nutritional information and tips on there as well. And so, thank you for having me. I think it's, there's
Great pleasure.
so much information that, we
can
could talk about.
Yes.
So
and right below the video, you're going to find a link to Dr. Cronin's website and her office address and phone numbers. Don't forget, leave a comment below. Thanks for watching. If you like this video, give it a thumbs up, share with your friends and family. They deserve to know the numbers that predict their health future. And of course, come on over to healingwithfoods.org, where you can sign up for periodic updates that I only send through email. Thanks again, and I'll catch you next time.